at a time. And some states will be able to open up sooner than others. Some states are not in the kind of trouble that others are in. Now that we have passed the...
So they're going to open it for the stages, and different states are going to open at different times. I hope this works well and it is successful. We need to get back to work.
Peak in new cases. We're starting our life again. We're starting rejuvenation of our economy again in a safe and structured and very responsible fashion. Our strategy will continue to protect senior citizens and other vulnerable populations while allowing military and other groups of incredibly talented people to go about their real business and the business that's supposed to be hard at work at doing, and nobody does it better. Our military is the greatest anywhere in the world, and we're so thankful for what they've done. Healthy Americans will now be able to return to work as conditions on the ground allow. Instead of a blanket shutdown, we will pursue a focus on sheltering the highest risk individuals, so important. We're establishing clear scientific metric and benchmarks on testing, new case growth and hospital capacity that must be met before advancing to each phase. And that's each phase specifically in the reopening of our country. This is a gradual process. As the caseload in a state continues to go down, restrictions can continue to be eased and come off. Throughout the process, citizens will continue to be called upon to use all of their weapons in this war, vigorous hygiene, teleworking when possible, staying at home if you feel sick, maintaining social distance, sanitizing commonly used surfaces, and being highly conscious of their surroundings. Those are our weapons, and they're very powerful weapons indeed. Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states. Every state is very different. They're all beautiful. We love them all, but they're very, very different. If they need to remain closed, we will allow them to do that. And if they believe it is time to reopen, we will provide them the freedom and guidance to accomplish that task, and very, very quickly, depending on what they want to do. We are also encouraging states to work together to harmonize their regional efforts. We'll have numerous cases where states have worked and will be working very, very closely together. As we reopen, we know that there will be continued hardships and challenges ahead. Our goal will be to quickly identify and address any outbreaks and put them out rapidly. If the virus returns in the fall, as some scientists think it may, possibly, these guidelines will ensure that our country is up and running so that we can likewise put it out quickly. At the heart of our strategy is the vital role of medical research, especially for therapies that will significantly improve outcomes for high-risk patients and reduce the need for urgent care. This will be tremendously valuable in allowing life to eventually return to normal. At least 35 clinical trials are already underway, including antiviral therapies, immune therapies, and blood therapies in the form of convalescent plasma. You've all heard about some of these events and some of these therapies. They've come a long way. What's been done in the last 4 weeks is incredible. We will also continue to expand our testing capacity. We have now completed more than 3.5 million tests, by far the most anywhere in the world. Areas of our country that have been hotspots have done much more testing. On a per capita basis, than South Korea. We've done more than South Korea, and South Korea has done a good job, but we've done more. We will continue to work with governors to advise them on how to conduct both surveillance and diagnostic testing. We have now distributed over 600,000 Abbott ID Now point-of-care diagnostic tests. These are tests that are done on site, and within 5 minutes you know the answer, positive or negative. In recent days, we have seen a dramatic increase in the number of tests performed by hospitals and academic institutions, with more than 120,000 tests recently reported in a single day, far more than any country in the world has ever been able to do. And our numbers are actually going up. As these new and better testing solutions come online, we're seeing this additional capacity reflected in the numbers. For this reason, the number of tests processed in commercial laboratories has dropped from approximately 100,000 to roughly 75,000 tests over the last week. The reason it dropped is because we have so many other tests and we don't even have to go through the laboratories. But the laboratories have tremendous additional capacity, and states feel free to use that capacity. Some in the media falsely reported this as a bad thing, when in fact it is a great thing, because it indicates that the states are moving to faster, more local testing solutions, including on-the-spot tests. So this drop in the utilization of commercial laboratories is an affirmation that testing, which is at an all-time high, growing at a historic rate. In other words, the laboratories are great, but now we have forms of testing that are much quicker, much better, and we don't have to use the laboratories, but they're there, and they have a great capacity to do the work. As Dr. Birx has been advising our governors for weeks, we continue to have an excess testing capacity of 1 million tests per week available for use, and our capabilities are growing every single day, especially with the new tests that are coming onto the market rapidly. As we begin a science-based reopening, we must be extra vigilant in blocking the foreign entry of the virus from abroad. Border control, travel restrictions, and other limitations on entry are more important than ever to keep the virus in check and allow Americans to get back to work. The sacrifices our citizens have made in this time of crisis will be remembered, studied, honored, and praised for generations to come. We're really all working together. Democrat, Republican, conservative, liberal, we're all working together. This is not about parties. This is about our country. Now the American people are ready to rise to the occasion once again. They are ready to show the world once more that Americans can defeat any challenger. Together we will rebuild this land that we love. We will reclaim the magnificent destiny that we share, and we will carry our nation forward to new heights of greatness and glory. I would now like to ask Vice President Mike Pence and Dr. Birx to further explain the new guidelines. I want to thank Dr. Birx. I want to thank Dr. Fauci, and I want to thank really especially a man who has devoted 24 hours a day to his task force and done such an incredible job, our great Vice President, Mike Pence. Please, Mike.
Thank you, Mr. President. The members of the White House Coronavirus Task Force today joined the President to meet with a bipartisan group of members of the House and of the Senate to get their counsel on the development of what the President unveiled to America's governors this afternoon. The new guidelines for opening up America again are a product of the best science and the best common sense that the President has marshaled on this team and from a broad range of advisors from all across the nation. From the moment President Trump established the White House Coronavirus Task Force early on, he made it clear that we have no higher priority than the health and safety of the American people. The President launched a whole of government approach. And while we stand here on this day with more than 640,000 Americans having contracted the coronavirus, and our hearts go out to the families of the more than 31,000 Americans who lost their lives and those who continue to struggle with serious consequences of the coronavirus. The truth is that because of the decisive action that our president took early on, suspending travel from China and thereafter from portions of Europe and South Korea, screening passengers, because of the strong actions in partnership with every governor across America, because of the extraordinary efforts of America's healthcare workers on the front lines, and because of the cooperation of the American people and God's grace, we are slowing the spread. We are flattening the curve. We have preserved the capacity of our healthcare system, and we've protected the most vulnerable. In a word, because of the actions of this president, this administration, governors at every level, our healthcare workers, and our fellow Americans, we've saved lives. And every American should be comforted by that. And we can see it in the numbers. In the charts that I'll present today, these three maps track influenza-like illness, which in this instance is mostly coronavirus across America. The first map reflects the total number of cases on the week ending March the 28th. The next map reflects our data about the total number of cases on the week ending April 4th. And we stand here today with the final map reflecting the total number of cases across America as of April the 11th. With these trends underway, President Trump tasked the White House Coronavirus Task Force to develop new guidelines for opening up America again. Those guidelines were presented today first to our nation's governors. And it is our intention at the President's direction to provide these guidelines to assist governors and state health officials in evaluating the most responsible manner to reopen the economies of their states at a time and manner of their choosing. The guidelines, as Americans who are looking on will note, begin with what is the best criteria that our experts have developed: a downward trajectory in cases over a 14-day period of time, ensuring that states have proper capacity in their healthcare facilities. The second set of proposals includes a description of recommendations for state preparedness. And let me say to the American people what President Trump made clear to our governors today, that our administration will continue to work day in and day out through our task force, through FEMA, to ensure that our states have not only the medical supplies, but that we continue to rapidly expand testing across the nation. The President reflected on the progress we've made on testing, but a few statistics for that as well, which I hope are an encouragement to the American people. On March 11th, we had performed a total of 23,588 tests. Because of the public-private partnership that President Trump initiated with commercial labs across the country, that number was 83,500 by March 18th. And as the President just said, that number is 3.5 million today. It is our expectation that we will have tested more than 5 million Americans before the end of the month of April, and we'll continue to scale those resources. So testing and medical supplies will continue to be an ongoing partnership with our states, and we want our healthcare workers and people all across the country to know of our commitment to that. Finally, the President directed us to propose a phased approach to reopening our economy. It is based on up-to-date data and readiness. We'll continue to provide the very best data to our states, working with their health officials. The focus is on the mitigation of any risk of resurgence or the emergence of the coronavirus in states where it's not yet emerged. There is a focus in the President's new guidelines on the most vulnerable. And we made this very clear to the governors today. These new guidelines for opening up America again can be implemented on a statewide basis or on a county-by-county basis. With that, I'm happy to turn it over to Dr. Deborah Birx. And if I may, Mr. President, I'd like to also extend my admiration and appreciation to Dr. Birx, Dr. Fauci, and every member of our task force that worked around the clock to develop these recommendations for opening up America, where I know every American is grateful for your leadership and for theirs. Deborah?
Thank you. Thank you, Mr. President, Mr. Vice President. We're going to go through these quickly because I know you have them and many of you have already spoken to them on television. Next slide, please. This is a very important slide. It talks about the gatekeeping criteria to moving into phase one. It's very much related to what you just saw about influenza-like illness. And the United States has been tracking influenza-like illnesses through the Centers of the Disease Control for years. Both the state and public health officials are used to watching this. County health officials are used to watching it. And frankly, every family around the United States knows how to access this on the CDC website in order to get up-to-date information to the communities. It also looks at a syndromic emergency room type visits, again, housed at the CDC, and really is our surveillance program that can be utilized for a lot of different illnesses, but in this case will be utilized for respiratory diseases. In addition, we are tracking the number of cases, and it must have a downward trajectory for 14 days, as well as the influenza-like illness and the syndromic illnesses, and a downward trajectory in the number of positive tests with persistence of high levels of testing. For the hospitals, it's to ensure that we can treat all patients without resorting to any crisis care, and ensuring that there's a robust testing program in place for at-risk healthcare workers, including frontline responders, with the emerging antibody tests. Next slide. Now, just to show you what this looks like. So what the CDC...
Emerging antibody test, that must be the Abbott test. It's unfortunate that we don't have more of those available for people that want to get back to work, so they can get that test and get back to work. 21 million people at least out of work, almost 22 million is a lot of unemployed people, period. They need to get back to work.
Did for me under the direction of Bob Redfield was to chart what the syndromic illnesses were reporting throughout the early part of March. And you can see in New Orleans, respiratory diseases were starting to be seen in the emergency room. That is the red line. The cases are shown in the dark blue line. The gray mountain is testing, and underneath that is the blue mountain of positives. And you can see that the early alert was present from the emergency room about early respiratory disease. You can see it predated the cases. So throughout the summer, when we do not have flu to contaminate this picture, we'll be able to follow this syndromic pattern, city by city, county by county, community by community, state by state. Next slide. In addition, the CDC has the influenza-like illness net distributed throughout the United States, very useful in the winter time. That first peak is influenza B in the red. That's this season. I showed you all the seasons here, so you could see the seasons as they are displayed. The first peak is influenza B, second peak influenza A, and then you can see the coronavirus, and you can see its decline, and it's declining towards baseline. This will allow us, again, city by city, community by community, state by state, to look for variations in an early response mode in those localities that I described. Next slide. So hopefully you see that we've brought CDC and their amazing talent of individuals at the Center for Disease Control and Prevention and all of their abilities to this response and also to the surveillance that we need in this response. But I want to call your attention to the third bullet on this graphic. So we're tracking those two pieces that I described. But the third bullet is about setting up sentinel surveillance sites to be able to distinguish and find asymptomatic individuals. Individuals that you've heard about that may be either pre-symptomatic or asymptomatic throughout their entire disease course. We want to be able to find them in communities of particular vulnerability. So we'll be doing sentinel surveillance throughout nursing homes, throughout inner city federal clinics, throughout indigenous populations, to really be able to find early alerts of asymptomatic individuals in the community, and both for the syndromic cases that are tested, the influenza-like cases, and the asymptomatic cases, doing contact tracing, again with support from the Centers for Disease Control, working with each state and local government. In addition, we want to make sure that all the healthcare facilities have adequate protective, personal protective devices and the equipment to handle the surge, and to ensure the ICUs can handle increased capacity. We want every state to have a plan for the health and safety of its workers in critical industries, and to protect the health and safety of those living in high-risk facilities, including senior care facilities, as we discussed with Sentinel surveillance.
Okay, for critical industries, I assume that that's transportation, food, medical, emergency. I'd like to know what the list on the critical industries are.
But also additional surveillance. When we talked with all of the states that had not had a major metro outbreak, their sentinel surveillances picked up always the first cases in nursing homes. And so this is a very much a big focus.
First cases in nursing homes. Again, we go back to the toxicity that we talked about, and the elderly in nursing homes are almost always prescribed medicines. And their toxicity is going to be high, and their likelihood of getting this because the toxicity levels is high. Go back to that video and look at what the doctor said about toxic levels. And this may not even be a virus, it may be a toxic level problem. And pharmaceuticals could be a great problem in this area, and it currently isn't being looked at like it needs to be in that area. Go back and look at my video on toxic levels.
Of the plan moving forward. I won't go into the rest of the details on this slide, but there's quite a bit of details on the expectations of every state and local government. Next slide. You'll recognize this slide. Next slide, please. You'll recognize this slide. It's what we've been talking about in the 15 and 30 days to prevent the spread. It's continuing those critical hand washing or sanitizers, not avoiding touching your face at all times, disinfecting surfaces, using face covering while in public, following state and local guidelines, and critically staying home if you are sick. I know a lot of people go to the workplace when they are feeling ill. You know when you're feeling ill. It won't get better by going to work. So we're asking again for people to stay home when they're sick. Next slide is for employers to ensure that there can be social distancing and protective equipment, temperature checks, use of disinfectant in high traffic areas, including break rooms, and ensuring that we don't do, there's no non-essential business travel, and then monitoring for any symptomatic individuals in the workplace. And again, if you become ill at work, to immediately to go home. And ensure that there's contact tracing of all the individuals that become sick. I'm going to go through the phases very quickly, but you have the details. Phase 1. Again, you have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing. So phase 1 begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place, and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings, and all non-essential travel. For the employers, next slide.
Yeah, it says, that was interesting, 10 people, non-gatherings of 10 people. So I'm afraid this is going to last out quite a while, maybe for months, and until it's up, but 10 people is not that many people. Ay, ay, ay.
Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage work return in phases from 20% or 25% to 40% to 50%. And again, minimize all non-essential travel. Phase 1 continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals.
Okay, if the schools are closed, they should remain closed. So I don't assume that, or I do assume that the schools are going to be closed until fall at the earliest, or until spring, or fall at the earliest, excuse me, that they will be opened again. If they are closed, they'll remain closed and probably until fall. We got to see what's going to happen in the summer and so forth, but hopefully we'll get back to normalcy to some extent before fall comes.
Hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they, again, could adhere to strict physical distancing, and elective surgeries can resume.
Okay, so gyms can be open, but there has to be distancing and so forth. So this is going to be a very different world as we look at things down the road.
On an outpatient basis. Phase 2. Next slide. Next slide. Again, you have to go through the criteria again of a continuation of another 14-day decline among those criteria that were in the gating. Again, we're asking for all vulnerable individuals shelter in place. We did not put a timeline on any of the phases. We want the governors, with the data that they have, community by community, to be set.
So a guideline is going to be set up by the governors. There's not a timetable on this. Interesting.
Up those timelines. Again, we're asking for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals, and non-essential travel can resume. Next slide. This is for the employers. We still would like to include
Non-essential travel can continue. Interesting.
Encourage telework, and the common areas should remain closed or be physically distanced. All non-essential travel for employees can resume, and then again, special accommodations for vulnerable. Next slide. This should be a relief to many of households that have small children. Schools, daycares, and camps can reopen in phase 2. Visits to senior living facilities, however, should remain in hospitals prohibited. Large venues can...
So in this phase 2, the schools can be reopened. That's going to be interesting. And when can the senior facilities be go back to normal? Maybe they never will be able to. Remember that visiting to living facilities and hospitals, senior living facilities, will be prohibited. It's most unfortunate for the elderly in those facilities.
Operate, but solely under moderate physical distancing, and elective surgeries can resume on an outpatient and inpatient.
Elective surgeries can resume in this phase 2. Very interesting.
Basis. Phase 3. And so phase 3, I won't go through in detail, is essentially returning to our new normal with all of what we talked about through all phases, continuing the good hygiene practices, continuing the respect for spaces between individuals, because we know that we still have an issue with asymptomatic spread. I do believe with this plan that we're both confronting the issue of finding symptomatic individuals through our networks with early alert, as well as those who come and present to different hospitals and emergency room with testing and contact tracing, but critically have put in place what we believe is a safety net through asymptomatic sentinel surveillance that is centered around our most vulnerable groups between nursing homes and our Native American people and indigenous populations, and our inner city groups that we know may be in multi-generational households and of unique risk.
Bust program for re-entering into normality. There's a lot of details here, and I know it'll take a little bit of time to digest them all. So what I thought would be good, since I really want to be brief to allow time for questions, is to kind of take us back to the discussions that we've had here before and why this is a natural evolution from what we had said before. You might recall that on a
Now, again, as I've said and stated before, I'll state again, I don't believe this is a natural evolution. Nature has to take its course, and it will. We can do what we can to distance and do other things to slow this down. But eventually, this will spread and get out. And again, with Stanford University studies, we believe that this has already been out of the box and been affecting people. And there are a lot of people that have been infected and have antibodies that have showed no signs. That study should be looked at much more carefully. And remember that Hannity brought that up. Sean Hannity brought that up on Fox News a day or so ago. And that should be relooked at and studied much more carefully than it currently is. Because if this virus has already been out and already infected a lot of people, they don't have symptoms. We need to test with the Abbott test to make sure that they have antibodies and they're safe to go back to work. And I don't know why that isn't being addressed more. Big question in my mind on why that's not being addressed more. Anyhow, we're going to end it here at a half an hour on this. And you can watch the source of this from Fox News. It's Roger Mark from Billings, Montana. I still say we have a lot of unanswered questions, and I think we've done very well as a nation. I think we've done way far below the projected results, and we have eliminated a lot of deaths, and the medical establishment should be commended, and so should the industry, individuals producing things, and so should other individuals that have worked so hard in transporting and helping and supporting this, as well as individuals that have been very good at doing what they need to do to sanitize things, clean things, prevent the spread. One of the big challenges, I think, is proper hygiene. And I think people need to use gloves better and dispose of those gloves better than they are, or just don't use them at all and wash your hands. And I don't know why that hasn't been addressed. But just throwing gloves on the sidewalks or on the pavement or in the stores, Walmart areas, is not good hygiene. And that needs to be addressed more efficiently. Again, it's Roger Martin from Billings, Montana. Good day, and I think we're going to move along here well through the summer. We will see. And hopefully we'll free up more people in more spaces and more groups to be able to do more of a normal meeting type situation for fall and actually get out and enjoy some of this summer weather soon. It's Roger Martin from Billings, Montana. Good day.